hope you enjoyed the short video, and it is a bird's eye view of what we are doing at the university. A lot is happening, and a lot needs to happen still. We are growing. We have a bold agenda for growth, and we are growing the university. So let me invite our meeting, Dr. Shahid Shafi. Dr. Shahid Shafi is a CEO, Chief Executive Officer of the Aga Khan University Hospitals in Pakistan. Dr. Shafi is an accomplished surgeon and healthcare executive. He is our own graduate of the class of 1988. So he studied at AKU and then came to United States, and now he's back and he's working as a CEO, which is another big accomplishment for the universities. After graduating from AKU, he has obtained an MBA and Masters in Public Health from Johns Hopkins University. Before joining AKU, he worked in senior positions in various healthcare settings in the United States. He was also elected councilman, City of South Lake, Texas, from 2014 to 2020. Ladies and gentlemen, please welcome Dr. Shahid Shafi.
Thank you, Nordos, for that wonderful introduction. Welcome, everybody. Thanks for taking some time out to come and indulge us. In the next about 20 minutes or so, I will talk to you about different aspects of. You have seen the buildings. Now I'm going to tell you the stories behind the buildings and the stories of lives and the things that we have touched and accomplished through those buildings. Buildings is just one piece. The fact that an educational institution has on the people that leaves a lasting impact. So my own story is that I would not be where I am today without the education that I received. In 1983, when the medical college opened its doors, I was one of the fortunate ones who was accepted there. There were about 1,500 applicants at the time. Of those 1,500, only 50 were accepted. Of the 50 who started in September, 42 graduated. And I was fortunate to be one of those 42 students. When I came to AKU as a young medical student, the only thing I wanted to do was to become a surgeon. But one of the things that happened at AKU is we dedicate about 20% of our curriculum time to public health, what we call community health sciences. And what that did to me, and has done the same to a lot of students who go through the medical, is it opens our minds to the possibilities that exist. It certainly opened my mind to the idea that a doctor doesn't work in isolation, a nurse doesn't work in isolation. There's a whole health system that is needed to deliver healthcare to the people where it is needed. After graduation from AKU, I actually spent 3 years in public health, working for USAID and some other places, and then I came to the US in 1990. My first stop was the Johns Hopkins University, and I did a master's in public health. And then after that, I did a residency in general surgery in New Jersey at New Jersey Medical School. Subsequently, I did a fellowship in trauma surgery and surgical critical care at University of Pennsylvania. And then we moved to Dallas, and we lived there for 20 years. And then it's only last December where I had the opportunity to return to AKU in my current role as the CEO. So for me, in a lot of ways, it's a complete circle. I'm back to where I started in 83, although in a different role. And it is great to be back. Some of the buildings that you saw here are the places where I trained, but a lot of those buildings have been developed, have come up in the last 40 years. I can tell you that during my career, I had the opportunity to get education and to train at some of the most competitive universities in the US. Like I said, I trained at the Johns Hopkins University, the University of Pennsylvania, Southern Methodist University in Dallas, and New Jersey Medical School. And in every place that I went to, I felt that AKU had trained me very well to compete, and not just compete, to compete and succeed in those environments. And then having learned all those things here and gained that experience, now I have the opportunity to go back to the institution and to go back to serve the country which gave us so much. And that is the theme of my talk today, that AKU is a national asset for Pakistan. And I'm going to give you some data and share some information with you to prove that point. That while AKU is not just an educational institution, it's a national asset for Pakistan. So if you were to broadly sum up what we do at AKU, you can put it in these 5 categories. Number 1 is we provide models of quality healthcare and education. We empower women. We are a trusted partner for the government of Pakistan and other governments, provincial governments. And we are also the face of Pakistan to the rest of the world. And I will cover each one of these areas briefly. So from where AKU started in 1980 with the first building that came up was the School of Nursing. Next, the medical college started in 83, and then the hospital started in 1985. But from there, where we are now, is right now we have 5 hospitals. We have the main hospital, which is on the Stadium Road campus that most people are familiar with. It is a 750-bed, what we call an academic medical center, which is affiliated with the medical college and School of Nursing. We also have 4 other hospitals, 3 of them in Karachi and in Garden East, in Karimabad and in Kharadar. And then we have a 5th hospital in Hyderabad. In addition to this, we have nearly 300 diagnostic centers all across the country. We, through these network, which is really the largest health system in the private sector in Pakistan. Through this system, we serve nearly 1.5 or 1.8 million patients a year. And when I say serve, we provide a full spectrum of services. We are not just a cancer center, we are not just a heart center, we are not just an infectious disease center. We provide full service of care. And our access through where we are located in the country that you can see on the map here, we are able to reach probably 60 to 70% of the population of the country has access to our services. When it comes to our educational program, which is, I believe, where our biggest impact is, in addition to offering an MBBS degree and a Bachelor of Science in Nursing degree, we also have all these other programs that we have listed here. We provide Bachelors of Science in Midwifery. We have a Master of Science in Nursing. We have a PhD program in nursing. In fact, when you look at nursing education, Aga Khan University was the first one in the country to offer a bachelor's program, a master's program, and now a PhD program. We produced our first indigenous PhD nurse last year. This is the first time in the history of Pakistan. So far, since the university started, we have graduated nearly 13,000 students. And of those 13,000 students, 60% live and serve in Pakistan. The ones who live and serve in Pakistan, the education that they received at AKU has really helped them build careers and helped their families rise up through their earnings. The people, 40% of the alumni who live outside Pakistan, they are all over, the largest majority of them are in the US. There is a large number in Canada as well, but our alumni are all over the world, including Europe, Australia, New Zealand, and the Middle East. These people who are living abroad, obviously they're all professionals, but a lot of them are also entrepreneurs. And they have in the US, they run large corporations and entities. They are in leadership roles now. And when it comes to Pakistan, they send money back to Pakistan. So they contribute in that way as well. And we have also seen people like myself and Dean Adil Haider who have spent decades in the US who are now going back to Pakistan to serve the country there. Our alumni also serve in institutions and government institutions in Pakistan. So you may have heard of other places like Shahid Shafi and Shifa and Tabba and Indus Hospital and government hospitals like NICVD. Our alumni medical college, school of nursing, and other education programs. They serve in all those places. So our impact of AKU is not just at AKU, it is all over the country through different institutions. One of the differentiating factors of AKU in Pakistan is the trail that we have blazed in multiple areas. We have been the first in Pakistan for multiple accomplishments. We were the first private university to receive its charter in Pakistan, that was in 1983. We were the first hospital in the country to be accredited by Joint Commission International. We are the first hospital in the country to be accredited by the CAP accreditation, which is, what does the C stand for, Adil? College of American Pathologists. So our labs are accredited by the College of American Pathologists, which means that the standard and the quality of our work in the labs and diagnostic in Pakistan is the same as what you would expect here in the US. We are the first to have the Bachelor's of Nursing, a Master's of Nursing, and a PhD in Nursing program. We were the first in the country to introduce the concept of medical records for patients. We were the first in the country to introduce the concept of having a physician's prescription to buy medications. We were the first in the country to introduce the concept of residencies and fellowship. In AKU was the first in the country to introduce multiple specialties that we now take for granted, such as family medicine and emergency medicine and neonatology. We were first in the country to require physicians who practice at our facilities, we require them to have specific credentials. Nobody can just come and start seeing patients at AKU. They have to have certain qualifications, they have to have certain experience, and we vet them before we allow them to see patients at our facilities. We are the first in the country to have a simulation, world-class simulation center. So when the trainees that we educate, the first time they are doing a procedure, it's not on a live patient. They train in a simulated environment, and then they go. They're allowed to see the patients. And this is just some of the few firsts that AKU has brought to Pakistan. In addition to that, we have done many unique things as well. AKU is the first to separate conjoined twins in Pakistan, and we have done 2 of them so far. AKU is the first to bring gene therapy to Pakistan. And then of course, there are some very basic concepts that we take for granted here, like antibiotic stewardship and the standards of sterilization of instruments and things like that did not really exist. Those standards didn't exist in Pakistan until AKU introduced them. Another is in the area of research, especially considering that we are working in an environment of a low to middle income country. The research produced at AKU now accounts for at least 60% of all the research that is generated in Pakistan. By some estimate, it may be as high as 80% of all the research that is generated in Pakistan comes from the faculty at AKU. And we have done our faculty have done some very unique things. We are also innovators. We are also innovate in different areas. We have designed the first low-cost portable ventilator, which is the size of a briefcase, which can be produced at a very low cost in low and middle income countries. AKU has its own app, which is called Family Hifazat, and through that patients can access their medical records. They can make appointments. They can do telehealth visits. So this is again very unique for Pakistan. AKU was the first institution to take care of a COVID patient in Pakistan. The first COVID response in the country was pretty much led by the AKU faculty and AKU physicians. The protocols that we developed were adopted throughout the country. Our physicians and our experts were invited to serve in the federal government and in the provincial government, and we are still doing that to guide their government's response to the pandemic. In fact, the most famous COVID doctor in Pakistan. His name is Dr. Faisal Mahmood. He's literally known as the Corona Wala doctor because he did so much to advance the care of COVID patients in Pakistan. He is a faculty of AKU. Not only that, he is actually an alum of AKU. He graduated from AKU Medical College and then came to the US for his training, and after his training he went back and has been working there since then. During the COVID pandemic, we also developed online educational courses for people who are working, and especially in government hospitals, and through those online courses we trained nearly 17,000 doctors, nurses and other healthcare providers all across the country. We also did the only randomized controlled trial for a COVID vaccine in Pakistan was done at AKU. So we have supported, AKU has been on the front line of COVID response in Pakistan for the last 18 months. We were the first and the only private hospital to start COVID vaccination. When the COVID vaccine came to the country, which was brought in by the government, federal government, and the federal government in the private sector, they only gave us the vaccine. And they only trusted us with the vaccine. I was there when we started our vaccination program. The first day that we opened our vaccination program, we were inundated by the number of people who wanted to get the vaccine. And if you're familiar with Karachi and where AQ is located, the Stadium Road, by 8 a.m. the Stadium Road was completely choked with traffic because everybody wanted to come to AKU. And we kept telling people that the same vaccine is available in other government hospitals. There were about 10 other locations, but people wanted to come to AKU to get the same vaccine. Why is that? The reason they wanted to come to AKU is because they trust the quality of care that we would provide, because it was not just about the vaccine, it was also about who's going to give me the vaccine, is that person appropriately trained, are they going to use a clean sterile syringe, and are they actually going to give me vaccine and not some sterile water? Will they keep record? And those are the things that we do so routinely and so well, and that's why people trust the care that we provide. First, for Pakistan. So far we have vaccinated, AKU has vaccinated nearly 65,000 people. Our own medical staff and our employees, while the vaccination rate in the country is about 20-25%, the vaccination rate of our staff and students is 99%. So almost everybody on our staff and we have a staff of about, and staff plus students of about 15,000 people, 99% vaccination rate, 99.9% vaccination rate. Another great accomplishment of AKU is that we take pride in is empowering women. A lot of our programs are predominantly student bodies, predominantly women, both in the medical college and of course in the School of Nursing. More than half of our faculty are women. Over a third of our employees are women, and nearly a third of our in leadership positions are women leaders. And why is that important? It is important because it's the mothers of the household that determine the health, the safety, and the education accomplishment of the family. So it is extremely important for us to empower women. And in a lot of these women who come to AKU for education or who come to AKU for their jobs and work there, that's the only place where their families would allow them to come and work. It's because of the safe environment that we provide for women to work. And for a lot of those women, they are the first in their families to get a university education and lift their families out of poverty. One of the less well-known things about AKU is how much charity care we do. Last year, we spent about $20 million in providing free of cost care to our patients. $20 million, which was our own revenues that were generated by operations were spent on providing care to patients who could not afford that care. And there were about 800,000 patients who benefited from that charity. We also subsidize the cost of education for our medical students and our nursing students. About nearly 30% of a medical student will receive some kind of scholarship or financial support from the university, and nearly 90% of the nursing student will receive scholarships and financial support provided by the university. We also have a zakat program. We do accept zakat, and last year we spent nearly we raised and spent nearly 500 million rupees in zakat money for people who are by Sharia definition are considered mustahikeen for those zakat funds. When it comes to complex care, we don't turn anybody away. When it comes to cancer care, for example, we don't just take care of early stage disease, we take care of patients in stage 3, stage 4 disease, or people who we know are not curable, but we are the first in the country to start palliative care services and hospice services. So these are, our doors are open to everybody, and we do a lot for the patients. I think about a third of our patients come from poor families who only earn, I think, less than $2 a day. I've already talked about a lot of these that we are, when it comes to professional advice, the government of Pakistan, the federal government, and the government of Sindh in Karachi, they rely on us in multiple areas. Our faculty members and people affiliated with AQU serve in all these different institutions that I've listed here, and this is not a comprehensive list. So the professional advice that we provide has really propelled and advanced the regulatory standards when it comes to medical education, nursing education, higher education, the board examinations and things like that. Our faculty also serves on advisory boards outside Pakistan as well at WHO level. Our direct role, we also, our alumni and our partnerships are also with some other non-profit institutions. I have just listed a few of these here. Aman Foundation, which started an ambulance service in Pakistan a few years ago. The AQU alumni and AQU faculty were the force behind setting up that ambulance service. This gentleman on the right, whose picture you see, which says Child Life Foundation, this is Dr. Nasiruddin Mahmood. He is an alum of AQU. And Child Life, he is the force behind Child Life Foundation, which many of you may have heard of and donated to it. Child Life Foundation's services are that they take over the emergency rooms of government hospitals, pediatric emergency rooms, and they run those emergency rooms in government facilities. And Child Life Foundation has shown that after they take over caring for those pediatric patients, the mortality of CPR, of patients who come in cardiac arrest, the mortality of those kids was reduced from 80% to 20%. And this is accomplished by AQU alumni. The Lifesavers program that you see the picture in the middle, that is a program to provide BLS training, basic life support training. So the same training, it's the same training from the American Heart Association, AHA program, that we have brought to Pakistan, and we have trained thousands and thousands of people in basic life support. Believe that we pitch Pakistan to the rest of the world. And again, it is through our educational programs, through our research programs, through our faculty and alumni. The gentleman in the middle, he's an alum of medical college, his name is Khan Siddiqui. He has developed the world's first portable MRI machine. He is based in Atlanta. His company is called Hyperfine, and he is an alum of AKU. The gentleman on the other picture that you see of the surgeons operating, that's Dr. Faz Bora. He is a cardiothoracic surgeon. And he's also an alum of medical college, AKU Medical College, and is in multiple leadership roles in the US, and has trained a generation of cardiac and thoracic surgeons here. The picture of the women that you see on the left, those are 8 alumni of AKU who were recognized by WHO as global women leaders in nursing and midwifery. 8 women who were recognized from Pakistan were from AKU. In addition to the direct impact of AKU, AKU also has an indirect impact because of the services that we buy, the vendors that we support, our employees, when they earn, they spend as well. So what we did was back in 2015, we wanted to see what is the economic impact of AKU on the economy of Pakistan. So we hired an independent group called the Centennial Group, and they came and evaluated it. And this Centennial Group is formed of former World Bank officials, and this is what they do. They measure economic impact of businesses on the communities that they serve. And in 2015, they estimated the impact of AKU on Pakistan's economy is worth $1 billion. So every rupee and every dollar that AKU spends has a multiplier effect of 7 times on the economy. And this is through giving purchasing power to its employees, through purchase of services and goods in the country. In 2018, this number went from 1 billion to 1.2 billion, which is an 18% increase in dollar terms, which is a real impact on population. The total number of jobs that while are directly, the jobs that we provide is about 15,000 people, but indirectly through different service contracts, we provide employment to about 55,000 people in the country. By services, all the buildings that were built, all the construction was done by, while the design was done by US-based companies, the actual construction was done by local contractors. So all the capital spending that we do, which is also worth millions of dollars, that's the money that is pumped into Pakistan's economy. And we do all that as a non-profit institution. It is a non-profit institution, and all the money or profits that are generated through our operation, they are reinvested in AKU and Pakistan. Not a single dollar leaves the country. We have the highest level of financial transparency. Our financial statements are audited by independent international auditors. You will have we use the same firms that you hear here, whose names you hear in the US, like KPMG and other audit firms. We have them come and audit our finances every year, and we have never had any issue with it. We do receive and accept donations from the US as well, and those donations are all tax deductible. They are routed through Aga Khan Foundation, which is based in the US as a 501c3 organization. So those donations are tax-free. But it is a not-for-profit institution, and all the money that it generates and creates stays in Pakistan. So we are continuously investing in intellectual growth as well as medical and academic facilities that we have developed in Pakistan. Our total, the size of the campus, main campus, is 83 acres, and we have about 2.5 million square feet of built-up space in that area. So that impact of AKU on Pakistan, which is why we believe that AKU is a national asset for Pakistan, and I'm thrilled to share some of these very high level. And I'm going to stop here. We'll have an opportunity to take some questions in a little bit. But in the 40 years that AKU has existed for, this is a huge impact. And this impact is only going to continue to grow over time. You saw the video of the campus, and we are not done growing. When we started in 1985, when the hospital started in 85, it had 10 ER beds, 4 operating rooms, and 50 inpatient beds. Today, that same emergency room, which had 10 beds, now has 60 beds. From 4 operating rooms, we have gone to 22 operating rooms. From 50 beds, we have gone to 750 beds. From one class of medical students of 50 students, we now have 5 classes with 100 students each. From having 1 nursing program and 1 medical program, now we have 35 residencies, 35 fellowships, 2 internships, and 17 allied health training programs, in addition to all the master's programs and the PhD programs that I talked to you about. And next year, we're going to start a 4-year liberal arts college, Faculty of Arts and Sciences, that is going to start in 2023. So that's... So thank you very much for your time and for listening to me. I'm next going to invite our Dean, Dr. Adil Haider. Dr. Adil Haider is also a fellow alum of the medical college, although much younger than me. He graduated in 1998. Also a fellow surgeon and a trauma surgeon with a master's in public health. After graduating from AKU, he spent a significant amount of time at Johns Hopkins University, where he obtained his training in public health and surgery, eventually becoming a faculty at Johns Hopkins University. From there, he was recruited by Harvard Medical School, and he went there and was one of the youngest professors there. And from there, he served at Harvard for many years, and his expertise is in global surgery, surgical access to surgical care, quality of care, and education. And AKU was very lucky to recruit him in 2019 to come back to Karachi. Again, an example of AKU producing talent that comes to the US, but then we are able to recruit them back to come back to Pakistan to serve. So, Adil.